Welcome to those who've joined today's talk. My name is Jessica Athens, and I'm the Policy and Research Officer here at the New York State Health Foundation. This webinar, COVID-19 in an Unequal World, is the third webinar in the Foundation's Practically Space. Today, we'll be discussing how race and socioeconomic inequalities drive disparities in COVID morbidity and mortality in New York State. Before introducing our presenter, let me go over a few housekeeping items. First, the webinar is being recorded, and a recap with a link to the recording will be sent out afterwards. Video and audio are disabled for attendees, so please submit any questions or comments you have into the chat box during the presentation. After the presentation, I'll read the questions submitted through chat for our presenter to respond. And with that, let me introduce today's speaker, Dr. Justin Feldman. Dr. Feldman is currently an assistant professor in the Department of Population Health at NYU School of Medicine. Next week, however, he'll be starting a new position as a research fellow with the Center for Health and Human Rights at Harvard University. Dr. Feldman is a social epidemiologist who studies the impact of structural racism and economic inequality on population health. So now I'll turn it over to Justin.
Thanks so much, Jessica, and thanks everyone for joining in. We only have 15 minutes until we're gonna start a discussion. So I'm going to have to take an enormously complex issue and make it very brief, but let's give it a try. Let me try to bring up my slides for you. Oh wait, no, I have to share my screen. 1 second. Can you see that? Okay. Looks like it's working. Okay, so this is going to be very New York City centric, and I apologize. I realize some of you are from other parts of New York State. And I also conceptualized this presentation long ago before there was the latest outbreak of protests and uprisings against police violence in the US, so I hope to tie it into that. So the United States is the richest country in the world. It is a settler colonial society, meaning it was founded on lands of indigenous peoples, but the settlers came to stay there permanently. It started with enslaved labor as one of its economic bases, and it also has a long history of dependence on migrant labor. And it is a very economically stratified and increasingly economically unequal society. And I suggest that all of these things have to do very much with the way COVID is bearing out in terms of who's getting sick and who's dying and who's suffering most of the consequences of it. And that New York City, being the global financial capital and also being one of the hardest hit cities, at least in this initial period of the pandemic, is not a coincidence. And there's no way I'm going to be able to sort of flesh out everything I just said there, but I will give you a little bit of a overview of what I'm talking about. So just a little background on zoonotic viruses. So people get sick from animals. That's one of the ways we get infectious disease. This is just the timeline of a 10-year period showing a bunch of novel viruses starting in animals, infecting humans. It's increasingly common that humans are getting zoonotic transmission of viruses for several reasons. One has to do with global economic destruction, and another has to do with an increasingly connected global economy where people are not just getting sick and in their local area, but where circuits of migration and economic exchange spread around viruses. So you can see here some lesser known viruses like Nipah virus and chikungunya and Crimean Congo, but also some of the earlier coronaviruses like SARS and MERS, and now of course COVID-19 coming perhaps from pangolins and initially from bats, though it's not entirely certain. So this is part of a growing pattern. And then you have the virus spreading around the world from China, but particularly to New York City via Europe. So the sort of genetic fingerprints of SARS-CoV-2 bear the marks of largely coming from Italy and other European sources to the US. And you can think about all the tourism and economic exchanges, and probably was initially concentrated among wealthier people, because that's precisely the people who are traveling often and traveling from Europe to New York City. And then I don't have to tell you, if you've lived through the last few months, we had a lot of people die. And some of these were counted as confirmed cases because the autopsy included a test for COVID-19, and some were considered probable cases. And then there's this so-called excess mortality, essentially how many more deaths are we seeing than we typically see at this time of year, looking at other years. So a lot of deaths that may have been COVID-19 related but weren't counted, or may have to do with the effects of economic lockdown, although that's not really clear yet. So this is a breakdown of COVID-19 deaths. It's current. I just got the latest data from the New York City Department of Health and Mental Hygiene website, looking at race, ethnicity in combination with age. And it's, unfortunately, I've highlighted not the age group I wanted to highlight. So what's in darkest is the 75 plus. So we know, of course, that older people have higher mortality rates. And then more and more research has come about showing that people of color, particularly Black, Latino, and indigenous people, have higher death rates and higher rates of severe COVID than white people, or non-Hispanic white people. But looking at the data overall sort of obscures that the inequalities are even bigger among younger age groups. So if you look at age 18 to 44, which is on each of these plots, it's not the farthest left, that's the youngest, it's the second to the farthest left, which is, you probably can't see my pointer. But yeah, that's just to say that among ages 18 to 44, death from COVID-19 is very rare, but the racial inequalities are even bigger. So there's a 5 to 6-fold higher risk for Black and Latino people among that younger age group compared to white people. Even if you were to look at the population overall, you'd see it's about double the risk for Black and Latino people compared to white people in New York City specifically. And so it's important not just to note that these racial inequalities exist, but to try to get to their root causes. There's no evidence that there are genetic or inherent biological differences in how people respond to COVID-19, but there's a variety of social factors relating to living conditions that are likely producing these racial divides. There are also probably economic divides, but we don't really have economic data yet, good economic data that may come later. But particularly in New York City, it's very hard to divide race from income. You have the median white household in New York City that is US born, makes more than double what a Black or Latino household earns in a year. This is just a plot I made from data, emergency department data, very early on. This is looking at data from March for people who visited emergency departments for so-called influenza-like illness, which was largely COVID, comparing to previous years to look at how many are actually attributable to COVID, and looking by zip code. And I'm looking at residential crowding, which is defined as, do you have more than one person per room living in your house or apartment, not counting bathrooms? There's a pretty strong relationship here where people who experience, zip codes where there's more crowding had higher rates of people going to the emergency department for what was probably COVID. And this sort of dovetails with what we know about transmission and how it's very easy within a household to transmit SARS-CoV-2, and it's very difficult to isolate. And also people who live in these types of houses are probably lower income, going out to work in essential jobs, and unable to protect themselves as much. And this came from a New York Times article where they analyzed proprietary cell phone data on social distancing. And they looked at, in different cities around the US, differences in the wealthiest versus the poorest neighborhoods in each of these cities. So the blue line is the highest income 10% of the population. And you can see their social distancing went up, or the line went down. So the distance they traveled went down both faster than the lowest income people and more quickly. So this, and this is largely related to work patterns and who has to work when and where. So this is just has to do with occupational segregation by income and exposure risk to COVID-19 based on occupation and socioeconomic background. And housing is very closely aligned with race and housing segregation. Here I looked at census data to say, okay, among white, Black, and Latinx people who are older, who are 65 plus, who's living with younger generations? And this multi-generational housing was pretty rare among white people, only about a fifth, whereas about half of older Black and Latino people are living with younger generations. So you have people who are younger, who are, because of their jobs, more likely to have to go out and work, more likely to contract COVID-19. And then they bring it home, and then they're more likely to spread it to older people who then suffer the consequences because they have the highest mortality rates. And then there's another part of the racial divide in mortality rates is so-called underlying health conditions. So people with heart disease and diabetes and respiratory conditions. And that is driven largely by environmental inequality of various sorts. And if you just think about who has pre-existing respiratory conditions like severe asthma, that largely is related to people's housing conditions and also the environmental conditions of the neighborhoods in which people live. So you then have economic and racial divides in those environments. This is just a photo from an environmental justice group in the Bronx, pointing out one particular campaign where they were opposing, I think it was a transfer facility for a corporation that would bring in more diesel exhaust. There's a lot of research on what's called environmental racism or environmental injustice about how lower income people, and particularly lower income people of color, are subjected to more siting of environmentally harmful facilities. And then you add indoor housing quality to that, and you have conditions that lead to greater severity of COVID-19. And again, I made this slide before months before George Floyd was killed. These were popularly shared in social media, looking at how is social distancing being enforced for different racial groups in New York City. On the left, you see someone who was pretty aggressively arrested, who is a Black man, for violating social distancing guidelines. And you had data released showing that nearly everyone arrested based on social distancing was a person of color. And then you have images in more affluent white communities where people are pretty close together. This was also before we knew that outdoor transmission risks were relatively low, but certainly not being arrested for their activities, even though they're pretty close together. And this is just sort of an alternative that I liked, where rather than coercively enforcing social distancing, which itself can spread COVID because of arrests and very high infection rate in facilities like jails and holding cells, you can just have guidelines in the environment that help people stay spread apart. This is a homeless shelter overflowing because they kicked homeless people off the subway system at night for cleaning, but actually to remove homeless people. And you have people without beds who are congregating, very high risk of COVID spreading here. And we've seen very high COVID infection rates among homeless people. And then there was a campaign to house homeless people in hotels, which are largely empty. And the Mayor de Blasio opposed that, although FEMA could have subsidized it largely. And then there have been, in addition to all of the uprisings against police violence and racial inequality we've seen in the last couple of months, there have also been specifically strikes against unsafe working conditions, and OSHA and other regulatory agencies are not really enforcing safety regulations that would keep people from being infected in work settings. So this is, I think, in Staten Island or one of the Amazon warehouses where workers went on strike temporarily to demand safer working conditions and shutdowns after someone tested positive. And here's just a map. There have now been hundreds of strikes, typically unauthorized, of working people throughout the country protesting unsafe working conditions and demanding safer situations from their bosses. And I think that's the 15 minutes. So I'd be happy to have a discussion. I can stop my sharing.
Thank you so much for that, Justin. That was really an amazing amount of content in a very short amount of time. So I'd like to invite others to submit questions, but sorry. I have sort of a starter question, which is rather broad, and it is, so in light of the pandemic and the recent murders of, Breonna Taylor, George Floyd, and Ahmaud Arbery, there's been this increasing national awareness about the legacy of slavery and how it continues to affect the well-being of Black communities. What policy efforts to dismantle institutional racism do you anticipate seeing in New York or nationally? And then what policies do you think would be most effective in repairing this harm, both as it's manifest in COVID and then other sort of health inequalities?
Yeah, and we're really seeing this intertwining of crises, both COVID, the disease, the economic fallout from that, and then this uprising against police violence, which there hasn't been a lull in police violence. This isn't new, but you often find uprisings against police violence and protests at a time of economic distress, and particularly economic distress among Black and Latino communities. In terms of policy, I mean, we're seeing this movement to divert resources from policing. You have cities like New York City spending close to majority or even absolute majorities of their budget on policing. And we've seen, from the lack of ability to deal with COVID-19 as a pandemic, we've underfunded social infrastructure and public health infrastructure. So one thing is to take money away from these sort of disciplinary institutions that have gotten a lot of funding, like police and prison, and putting more funding into social care and redistribution.
It's been, let's see, here's a question. It's been about 30 years since the LA riots and the Rodney King, severe sort of beating by the police and the riots it sort of resulted in. So what do you think is really going to take to turn this this around, like shifting from this sort of carceral police state sort of behavior towards communities of color and really making a change?
Yeah. So one thing to think about is there actually have been changes in the criminal legal system, both for worse over that time, also arguably for better. So kind of shockingly, and I was surprised to learn this, even given how cynical I can be, it wasn't until the 1980s that police had basically any restrictions constitutionally on their use of force. It wasn't until the 80s until it became illegal throughout the country to shoot someone just because they were running away from a police officer. Um, so we've seen, actually, we don't have national data, but if you look at cities that have historical data, you've seen a decrease in people being killed by police over time, though it's still unacceptably high and we should have zero. At the same time, you've seen a pretty dramatic increase in incarceration and sort of more invasive policing into various aspects of people's lives. I'm pretty hardened by the movement to defund police. Often reform efforts in both in prisons and policing, even well-meaning ones, have either not worked or even made the problem worse. So mandatory minimum sentencing for policing was really about reducing judges' discretion thought about racially, saying, okay, we can just have a rule, everyone has to be sentenced for at least this amount of time, and that increased the incarceration rate. So really we need less policing and less incarceration, and not try to make them kinder and gentler institutions.
Mm-hmm. And another question that I have is, I think a lot of this comes down to political will. And do you see that emerging? I mean, we see it sort of among the population, but in terms of, you know, our elected representatives, kind of what is your sense of the political will to actually make shifts that eliminate these disparities?
So thinking about COVID and policing and everything else, it's really hard to say. I think historically, what we've seen that have improved the conditions for Black people in this country in actually meaningful ways, we've seen the Civil War and Reconstruction, and we've seen desegregation and the toppling of Jim Crow. And those required decades-long social movements that had many failures along the way, and required, in some cases, military force, or even in the case of Jim Crow, just the threat of military force. A lot of Southern governors backed down because they thought LBJ was going to deploy the National Guard. So really what we need is sustained social movements like the kind we're starting to see now, and will hopefully continue, and eventually political alliances through the state that can help them achieve power.
Mm-hmm. I have a few more questions. I know we don't have tons of time. Let's see. The first question is, what are your thoughts on the indigenous communities of the U.S. having some of the highest rates of COVID? Do you think that there's actually some intentionality in the way that that's sort of happening? And then with the recent protests, have they added to the increase in Black communities and communities of color testing positive for COVID?
So in terms of indigenous peoples, which I didn't focus on because my focus was in New York City here, yes, there's very high rates of both infection and death. I think the neglect is intentional, and we've seen a very long history of that. And there's also active harm being done to indigenous communities, including sterilization, involuntary sterilization, and taking away of children into adoptive custody very recently until the 70s and 80s. And all of this compounds, and all of this lives on in the bodies of people physically in terms of trauma and stress and physical illness that leads to higher mortality rates. We've not seen that much evidence yet of protests spreading COVID. I was actually actually part of a group that was trying to design a study to see whether that was happening in New York City. And we estimated the rate of active COVID infection in New York City during the protests peak was maybe 1 in 1,000 or 1 in 500. So it's possible these things grow exponentially, but I don't think we've seen it in New York City yet. And I'm not sure there's clear evidence of that elsewhere. I've been out there, being outdoors and wearing a mask, and the vast majority of people are wearing masks, is likely on the safer side. However, being arrested at a protest and spending a lot of time in custody is not.
Mm-hmm. That's all really helpful. I have another question, and this is from a physician, and they're asking how, as a group, can they better reduce the spread of COVID, regardless of the sort of racial ethnic background of the patients? Are things only going to get better via vaccine, or what are some other ways to sort of reduce the spread in disadvantaged communities? And then, and finally, what's your sense of vaccine availability? Like what is that timeline really looking like?
Yeah, so I have no special insight into when a vaccine will be available. Certainly, it would be good if it was, and it would help overall, and it would help in terms of racial inequalities, most likely. However, we've seen in New York City, we had this huge, you saw the plot I showed, huge number of deaths, going down to very few, going down to days with 0 deaths, very few infections, exactly because of the policies we've implemented around social distancing, closing institutions, et cetera. So I would say we're being presented with a false dichotomy of reopening and helping the economy versus keeping people safe. And by people, it's particularly working class and people of color. There are ways to support people economically who are not working or who have to work in some reduced capacity rather than forcing them into work in unsafe conditions. So I think that's really at the level of policy.
Okay, let's see. People are getting on a roll now, so let's see. So do you think that the recent uptick in arrests related to the protests are going to add to the COVID cases? And what is, so we were just talking about policies related to sort of limiting the spread of COVID in disadvantaged populations, and one of those is people who are incarcerated either in jails or in the prison system. So are there any practices that can be engaged in sort of in jail or prison that can also limit the spread of COVID?
Yeah, so a couple of things. New York City, on the average day, maybe 150 or 200 people are arrested. There were roughly 1,000 arrests related to the protests. So in the grand scheme of things, it's small compared to arrests in general. I would say arrests in general are almost certainly contributing not just to spread within jails and holding facilities, but also in communities. And I actually hope to look at that through more research. Well, what was the other part of the question?
Oh, it was talking about social distancing or,
within,
other mitigation.
Yeah, people lack in jails and prisons are lacking basic things like soap. That's a no-brainer. But so many people can be let out, and some have, but not nearly to the extent that one would like. Iran let out 1/3 of the country's prison population, specifically related to COVID and the very high rates there. There's no reason why in the United States we have so many people who pose no risk to the public can be let out and free up space in the facility to make them less dangerous. But we've barely seen that.
So let's see, social distancing or other initiatives we should be fighting for those in holding cells or incarcerated right now. The person who asked that question is, what should we be agitating for? And sounds like it's, access to soap and basic hygiene requirements, which isn't always available, and then also releasing people who are not actually a risk to the community, but are currently being held within a jail or a holding cell.
And there's a campaign in New York City, at least, maybe it's wider, called Free Them All for Public Health. And you can Google that, and there's some organizing effort there.
Okay. Let's see. There are a couple more questions. Some of them are like really, this is a really large question, but I think it sort of gets to the economic, sort of the racial economic underpinning of the disparities in health, which is, someone asked if, do you think that Black Americans should get reparation for slavery to help bridge the income gap that we see, which has persisted, you know, over time?
Yeah, absolutely. And not just for slavery, but for the many different forms of injustice that very directly impacts the state of Black people's economic well-being today. But there's also so unionization, for instance, increases racial equality by economics. So reparations is one part of it, but we also need to be looking at other parts of the picture.
Let's see. I'm just trying not to miss anything. Let's see. I don't know. Some of these may be out of your purview. So one person was curious about, you know, when will hospitals be able to open as usual again? For example, and med students can do clinical rotations, or do you see that as far in the distance, or?
Yeah,
or maybe it's not.
Yeah, I don't really have any special insight into that. My sense is that the numbers will go up and down. I think in New York City, as we start to reopen, and particularly if schools reopen, which is a big question, both K-12 and universities, there could be a major uptake, and there's some evidence that there's some seasonality to it. So we're actually doing quite well right now, but don't be surprised if in a few months we're back in the worst of it.
Yeah. Okay, well, you know, this has been really great, but we're just a little bit over time. So, you know, I'd like to thank you, Justin, for joining us, and also all the people who attended today. As a reminder, the recap of the talk with a link to the recording will be sent out later and also posted on our website. And then please consider attending the next webinar in this series, which is Combating Misinformation in a Pandemic. That session will be held on Thursday at 1 p.m. And with that, thank you so much.
Thanks for having me. Appreciate it.